The case is a young female state league netballer that sustained a left ACL injury which required a reconstruction via hamstring graft. She went through a 12-month rehabilitation program that focused on increasing her range of motion, quad activation, and general strength. She is wanting to return back to sport and has been asked to complete a testing battery. The primary physical demands that she'll be returning to, which may impact her abilities, would be change of direction, skills in jumping and pivoting, as well as other attributes such as strength, power, and speed, etc. The aim of the testing battery is to assess the player's physical performance post-injury rehab for a safe return to sport and should include multiple categories to test. Some examples of these test categories are listed below and generally include functional movements, strength, power, agility, sport-specific movements, etc. For the test selection, the criteria for determining successful result is listed below, as the criteria includes the Limb Symmetry Index, which assesses the comparison of performance for both limbs, the Landing Error Scoring System, which focuses on identifying landing errors and technique, Apprehension and Confidence, which focuses on the player's psychological response, and lastly, their pain during and after completing the test. The single leg hop test is effective at assessing knee function and movement. The test focuses on how the single leg performs at generating force and power during the push-off phase, as well as its ability to stabilize the body, neuromuscular control, and how the body responds to high eccentric loading when landing. This test also helps to mimic netball-specific movements as it focuses on when players are pushing off from the ground and landing when catching the ball. Also, in relation to the case, this test will determine the client's confidence at performing jumping and landing movements prior to returning to sport. The testing protocols include the starting position, where the client is standing single leg in between two markers. The testing surface will preferably be on a netball court or hard surface to mimic the environment. A successful result is defined as when the client is able to take off and land on a single leg without the loss of balance. The client is allowed to complete 1 to 3 practice jumps before commencing, and then will complete a total of 3 jumps on each side. 30 seconds to 1 minute is given for rest, and after each jump, the distance achieved will be recorded. Some test cues that can be included would be focusing on landing softly and to try and generate as much power in the leg for a big takeoff. The criteria requirements include an LAS score of equal or greater than 90%, which is determined by the distance achieved on each leg, a LES score of less than 5, which is determined by video analysis and assessment from LES criteria, low apprehension, which can be an absence of hesitation before takeoff or only jumping a short distance, high confidence score, pre and post jumping, so that it shows the client is confident at performing the skills. Lastly, a low pain score of less than 3 to 5 to determine that the client didn't experience any pain during or post push-off and landing. Some advantages of the test include that the test is cost-effective, easy to measure as it is primary objective in terms of distance and technique, time efficient as it takes a short amount of time to complete the test. Some disadvantages include the psychological impacts, which may mean if the client is unable to complete the test or do it incorrectly, it could cause some fear or doubt, as well as the risk of re-injury if the client completes the test incorrectly. The drop box deceleration test focuses on single leg landing technique and mechanisms, as it determines lower limb neuromuscular control and the injured leg's ability at decelerating the body during the landing phase, while also stabilizing the body itself. As also mentioned in the case study, the client is quite apprehensive at completing single leg drop box exercises, so this will also highlight if the client is able to complete the task without hesitation, so that they have a high confidence when returning to sport. The starting position includes the client standing on top of the box with one leg in front and the arms either side. The box is set initially at 30 centimeters with the test surface either on a matted or hard floor. The landing is determined successful when the client is able to land and retain balance without any pain. Before commencing, the client can perform 1 to 2 practice landings and will complete an overall 3 landings on either leg. Some test cues that can be incorporated would be to focus on decelerating the body when landing, don't depend on arms to regain balance, and to land softly. The criteria requirements for the drop box test to determine a successful return to sport include a LESS score of less than 5, which is determined by analyzing the landing sequence through video analysis and assess the technique against the criteria. Some technique objectives, which include knee flexion of between 60 and 0 degrees during landing, minimal knee valgus, landing duration of less than 1 second, and retains upright trunk flexion. In addition, another criteria that would be significant for the client's case would be their apprehension and confidence. The apprehension to the test will be determined by the supervisor to see if the client hesitated before commencing the landing or expresses that they were not willing to complete the test. In addition, their confidence score can determine if the client is psychologically affected and is able to complete the task confidently. Lastly, the pain score of less than 3 to 5 on the scale can also determine if the client is experiencing any physical pain. There are many advantages to this test, which include low cost as there isn't much equipment required to complete the test. It is also time efficient as they are only completing a couple of landing sequences. It may also help to improve the client's confidence and decrease any fears and doubts that they may experience. And lastly, it can easily be progressed if the client finds the task too easy. An example of this could include a drop box into a vertical jump. Some disadvantages for this test include the potential risk of re-injury if the client performs the landing incorrectly, as well as psychological impacts which could cause doubt or fear in the client. The isokinetic strength test for the quadriceps and hamstrings is effective at determining the average and maximal strength of the muscle groups. This is important as both muscle groups are affected by an ACL injury due to its loss in strength from immobilization and graft taken from the reconstruction. During rehab, the aim is for the muscle groups to improve and try and return back to baseline measures pre-injury. Therefore, this test can also help determine where the client's strength is in comparison before sustaining the injury. The test also highlights strength comparisons between the injured and non-injured limbs and the hamstrings to quadriceps ratio. The test can also help identify any underlying imbalances or weaknesses that the client may have before returning back to sport. The test procedures include using an isotomic dynamometry device, which has the client in a seated position with straps around their body to keep them in place. In determining a successful result is when the client is able to fully contract either the hamstrings and quadriceps at maximal effort without expressing any pain or discomfort. Before commencing the test, the client can practice the test by performing knee flexion and extension in a seated position with a machine or resistance band. The client completes 3 to 5 reps of concentric knee flexion and extension. The angular velocity is set at 60 degrees seconds and range of motion is between 0 to 100 degrees but generally is at 40 degrees. If the client expresses any pain, discomfort, or doubt before or during the test needs to stop immediately. The criteria requirements includes using the peak torque results, which can determine the LIS score that needs to be greater than 85% of strength for both the quadriceps and hamstrings. In addition, by using the peak torque, it can determine the hamstrings to quadriceps ratio, which needs to be greater than 55%. Additionally, the pain score should be less than 3 to 5 on the scale. Alternative testing methods may include completing a thigh circumference test or 1RM leg press. However, this would be difficult in measuring specifically the hamstrings and quadriceps. Some advantages to the test include low apprehension as the client isn't performing any high-risk movements. It is considered to be a high standard of strength testing. Also, depending on the client's abilities, it can also be time effective. However, disadvantages may include that you require specific testing equipment, which will then affect the cost to run the test as well as the space required for the equipment.